That there's never been any doubt in my mind that I wouldn't be cured of this. Once I found out, I just made up my mind, that's it. You just have to keep taking it one day at a time and just keep that positive attitude and know that I can do this. I'll get through it.
It's 8 o'clock in the morning, July 17th, 1997. We're at St. Luke's Hospital, and we're about to do the first case in the St. Louis area of ovarian tissue freezing.
Okay, well, I'm Dr. Silber, Sherman Silber, the Infertility Center of St. Louis, and we really have a treat right now. This is Jennifer, who at 24 years of age, I'm right on that,
yes,
right? Came down with a terrible case of leukemia. They thought she was going to die, but just to be safe, in case she lived, when she did, and was cured, we would freeze her ovarian tissue. So that was like 20 years ago. And this is the first case that we ever did, and we're the only ones right now really actively with a program in the whole United States. And it's been a long time, and we didn't know that we'd be able to transplant the tissue back, and we didn't know if we could culture the tissue. And here she is now. We had her on Facebook Live several months ago, and she was happily pregnant, and now look what we have. Now she's 44 years old, if I can reveal that, with a 24-year-old ovary, and a beautiful baby. What's her name again?
Madeline Grace.
Madeline Grace.
Amy Tucker began nursing school in 1997. Just 1 year into her studies, in a devastating twist of fate, she became the patient. A biopsy of an enlarged lymph node revealed she had Hodgkin's lymphoma, a potentially fatal disease. Amy endured 6 months of chemotherapy, went into remission, and then resumed a full load of classes. At just 20 years old, she was once more fighting for her life. Doctors told her this new round of chemo would likely make her sterile. But right before the treatments began, a nurse told her about a new procedure that could preserve her ovarian tissue. Amy met with Dr. Sherman Silber, a pioneer in ovarian tissue preservation at St. Luke's Hospital in suburban St. Louis. She would become the second woman in the United States to have this experimental procedure. Using laparoscopic surgery, Dr. Silber removed her right ovary. That layer contained the follicles which produce eggs and could be stored in liquid nitrogen for years until Amy decided to try to have a family. After a grueling round of chemotherapy, radiation, and a bone marrow transplant, Amy was cancer-free and ready to move forward in life. Amy was now 31. And the couple's only hope to conceive a child was to transplant tissue from the ovary, extracted and preserved 11 years earlier.
Dr. Sherman Silber, Infertility Center of St. Louis, and I'm here with the most amazing fertility story ever. This is Amy Tucker. I've known her since she was a little 19-year-old girl who was facing death with Hodgkin's disease, a terribly difficult case. And she's got 2 children from her frozen ovary that we froze before she underwent her chemo and bone marrow transplant that sterilized her, and she's now pregnant with twins. She's going to wind up having 4 children from this ovary we froze before she had this life-threatening cancer and was treated for it. So here's Amy.
The fact that I couldn't have children really scared and frightened me.
2 years ago, at the age of 21, Melissa was diagnosed with Hodgkin's lymphoma. She was told her treatment would include very high doses of chemotherapy.
I thought, I'm young, I can do it. The odds are looking really great for me. Hodgkin's lymphoma, very curable. And then I really started looking into my papers and my books that you get, and I came across fertility, and I burst into tears. I don't have a biological clock anymore. He took it away from me. So when I'm ready to have kids, it's not going to be a problem.
Well, Melissa, this is a fantastic moment for all of us.
It is.
I mean, when are you going to have the baby?
We are scheduled for a week from yesterday, so 6 more days.
6 more days, and you look really ripe.
I am very ripe, yes.